Chronic myelogenous leukemia, or CML, is a cancer of the white blood cells. These cells tend to be in the myeloid stem cell lineage, and because it is a chronic leukemia, these cells tend to be more mature, so you see more granulocytes, red blood cells, and platelets, whereas if it was an acute leukemia, you'd see more myoblasts. Okay, so this leukemia begins with a mutation in the chromosomes where a gene on chromosome 9 is shuffled to be attached to chromosome 22. This is the ABL gene, and it's being translocated onto the BCR gene of chromosome 22. This new chromosome creates a tyrosine kinase receptor in the cell. And so in the signal transduction pathway of a normal cell, you see that this tyrosine kinase, the receptor protein, must have a signaling molecule bind to it to phosphorylate these tyrosine kinase, or the tyrosine inside the receptor. These tyrosines set off a phosphorylation cascade of the RAS pathway, and this RAS phosphorylation cascade leads to the nucleus, and it leads to cell proliferation and cell division. In the new BCR and ABL tyrosine kinase, what happens is that this new receptor doesn't have a gene that tells it when or when not to start phosphorylation cascades. So this receptor is constantly telling all these proteins to begin their cascade. So it has the same pathway of the RAS that leads to the nucleus, and this also creates rapid proliferation and cell division. And so basically, cells are constantly dividing and reproducing. This leukemia has 3 phases. The first is the chronic phase, which has abdominal fullness in the spleen and liver causing enlargement. This is because the blood cells being mass produced must be processed by the spleen. And all this being processed causes the spleen and liver to be enlarged because it's very overwhelming. And because of this, this mass production of white blood cells, not all of them can be processed, so much of them become defective. In the second phase, also called the accelerated phase, you get easy bleeding, which is due to the defective platelets because they cannot be processed. Platelets are supposed to clot blood or bleeding, but they cannot anymore because they're defective. In the third phase, also called the blast phase, you have a lot of fever and fatigue because of infection from many microbes seeking opportunities because of the defective white blood cells, because they can't fight infection. For diagnosis, you can get a blood smear, which is what this is. So basically they take your blood and they look at it through a microscope, and you can see this blood smear right here has the normal amount of white blood cells and red blood cells. The red blood cells are the small ones, and the white blood cells are the big purple ones. And so this is the appropriate ratio. On this side, you can see that there's way too many white blood cells in the bloodstream. And so this is one way they could diagnose you with CML. Another way is to have a FISH test, which is a fluorescent test that shows chromosomes 9 and 22. This green fluorescent color is chromosome 9, and this is 22. But when you see that they are attached, then you see that both of them can show up together. The leading treatment of CML is imatinib, which is a competitive inhibitor in the ATP binding site. So normally a substrate fits into the ATP binding site and is phosphorylated to begin a cascade. But with imatinib, it competitively inhibits the ATP binding site so substrates cannot be phosphorylated and begin a cascade. And this stops all white blood cell production where these myeloid stem cells are affected. So another thing that patients have to do sometimes is get an allogeneic stem cell transplant, which gives patients the needed products of tyrosine kinase receptors to make white blood cells when they need it. So that's chronic myelogenous leukemia.